Hello and welcome. Today, we'll be discussing cervicitis, an inflammation of the cervix, the lower narrow end of the uterus that opens into the vagina. We'll explore its causes, symptoms, diagnosis, and treatment to help you understand this common condition. Cervicitis isn't a disease itself, but rather a condition caused by several factors. The most common causes are sexually transmitted infections, or STIs, such as chlamydia, gonorrhea, trichomoniasis, and herpes simplex virus, which is HSV. However, cervicitis can also result from non-infectious factors. These include allergies to spermicides or latex in condoms, irritation from douches or tampons, bacterial imbalance, or even physical trauma to the cervix. The underlying pathophysiology of cervicitis involves an inflammatory response of the cervical tissue. When an infectious agent or irritant comes into contact with the cervix, the immune system triggers inflammation. This inflammation leads to swelling, redness, and the production of mucus and pus. In chronic cases, this inflammation can cause changes in the cervical cells, potentially leading to complications if left untreated. Cervicitis is a relatively common condition, particularly among sexually active women. The exact prevalence is difficult to determine due to many women experiencing mild or no symptoms. However, studies estimate that millions of women are affected each year, especially those who have multiple sexual partners or engage in unprotected sex. It's important to note that cervicitis affects women of all ages, although it's more common in those of reproductive age. The symptoms of cervicitis can vary from mild to severe, and some women may not experience any symptoms at all. When symptoms do occur, they can include abnormal vaginal discharge, which may be yellow, gray, or white. Other signs include bleeding between periods, pain during sexual intercourse, painful urination, and pelvic pressure or pain. It's important to note that these symptoms can also be associated with other conditions, so it's crucial to seek medical evaluation for proper diagnosis. Diagnosing cervicitis typically involves a pelvic exam by a healthcare provider. During this exam, the doctor will visually inspect the cervix for signs of inflammation, redness, and discharge. They'll also collect samples of cervical cells and vaginal fluids for laboratory testing. These tests can identify any infectious agents, such as STIs, that may be causing the cervicitis. A Pap test may also be performed to screen for abnormal cervical cells. Cervicitis can be broadly classified into two main types: infectious and non-infectious. Infectious cervicitis is caused by bacteria, viruses, or parasites, typically transmitted through sexual contact. Non-infectious cervicitis, on the other hand, is triggered by irritants, allergies, or trauma to the cervix. Treatment for cervicitis depends on the underlying cause. If an STI is identified, antibiotics or antiviral medications will be prescribed to eradicate the infection. It's crucial for both partners to receive treatment to prevent reinfection. For non-infectious cervicitis, eliminating the irritant or allergen is key. Avoiding douches, switching to hypoallergenic products, and using water-based lubricants during intercourse can help alleviate symptoms. In some cases, topical corticosteroids may be prescribed to reduce inflammation. The best way to prevent cervicitis, particularly that caused by STIs, is to practice safe sex. This includes using condoms consistently and correctly during all sexual encounters. Limiting the number of sexual partners and getting regular STI screenings are also important preventive measures. Avoiding douches and harsh feminine hygiene products can also help prevent irritation and inflammation of the cervix. The prognosis for cervicitis is generally good with prompt and appropriate treatment. Most cases resolve completely with medication or by addressing the underlying cause. However, untreated cervicitis can lead to complications, such as pelvic inflammatory disease, infertility, and an increased risk of ectopic pregnancy. Recent research is focusing on developing more effective treatments for persistent or recurrent cervicitis, as well as exploring the role of the vaginal microbiome in cervical health.